Welcome to Bench to Bedside, a weekly series of live conversations about recent advances in cancer, from the research bench to treatment at the patient's bedside.
58-year-old Brian Mann is prepping food for the week.
This is my go-to.
But 80 pounds ago, his choices were much different. Cabbage and carrots weren't on the menu.
A lot of processed foods, a lot of fried foods, cakes and cookies and donuts. When I would travel, donuts would be my go-to.
But a prostate cancer diagnosis changed all that.
Cancer is always a word that you don't want to hear.
But when he heard it more than a year ago, he was 316 pounds.
I realized that if I did a journal on my eating, I would be writing all day long. I just ate because I enjoyed eating.
And not just cancer, high blood pressure, diabetes, and the nutritionist at the University of Kansas Health System made him rethink what he was putting into his body, which now includes more fruits and vegetables and a new appreciation for water, less sugar, salt, and portion control.
It finally clicked. If you eat this, this is what you get. If you eat something else, then this is what you can have.
Brian is a married father of 3 and heads up the congregation at Bethel Church.
I think it really had to do with a culmination of how do you want to spend the rest of your life.
Since his diagnosis, the link between nutrition and cancer is clear.
Nutrition helps. Even if you haven't been diagnosed with cancer, maybe you have a family member that's been diagnosed. It's time to make changes.
Especially for the grandkids.
Nutrition is really important. If you have been diagnosed, give your body a fighting chance.
We have all heard that eating a well-balanced diet, nutrient-rich with foods that include fruits, vegetables, and proteins, are good for our health, but undergoing cancer treatment can complicate that. At a time when optimal nutrition is so important, treatments like radiation therapy and chemotherapy can cause patients to lose their appetite. Good morning. I'm Dr. Jennifer Klemp, sitting in for our Cancer Center Director, Dr. Roy Jensen. And with me is Dr. Jill Hamilton-Reeves, a dietitian, a certified oncology dietitian, and our co-director of the Nutrition Shared Resource at the University of Kansas Cancer Center. Today we are talking about the importance of nutrition and diet during cancer treatment. And thank you for joining us today on Bench to Bedside.
It's great to be here. It's good to see you, too.
You too. You too. Not only is Dr. Hamilton-Reeves a well-known researcher, but she's also a good colleague. And so I'm excited to talk to you about why nutrition is so important in cancer treatment today.
Yeah. Do you want me to take that as a question?
Go in.
Well, as you had mentioned, cancer treatments place a demand, an extra nutritional demand on the body. And certain treatments actually create more of a specific nutritional demand. So, getting patients ready so that they have the nutrients that they need at the time of treatment is really important. And then more generally, there's a lot of data suggesting that people that lose muscle mass and strength have consequences in the way that we can treat them. So they might have more side effects from chemotherapy, or they may not be resilient and strong enough to take the full dose of the medication, so they have dose reductions. It's associated with more post-operative complications if people don't have enough muscle mass and strength at the time of their surgery. So yeah, that's why we're here. That's why we want to help build resilience and help people undergo their treatments and get on with their lives.
That's great. And I think, one of the most common things that we hear from patients, especially during treatment, is that sometimes things just don't taste the same. Sometimes, it's hard to deal with some of the side effects, or even some metallic tastes, or they're not getting enough water. What kind of are some of the tips that you and your team would give to patients as they struggle to, find those nutrient-rich foods and hydration?
Yeah, absolutely. So I'm going to go back to a comment you made in the introduction about appetite. So just speaking really generally about appetite, one of the things that we work on first with patients that are struggling with that is to stay ahead of the hunger and stay ahead of the appetite, because once it once that sets in, then people actually become a little bit more nauseous and it's harder for them to eat. So one of the strategies that we use is having them eat smaller, more frequent meals, maybe 5 to 6 times a day. And if they're still struggling, to focus on protein first. Again, kind of going back to that comment about really wanting to keep people strong and keep their muscle mass in, that protein is going to help sustain those muscles. And then you had talked about some of the side effects from very specific treatments. So you mentioned the platinum drugs and how they can make a metallic taste. There are some really simple things to do. So using plastic silverware or wooden silverware instead of metal silverware actually kind of helps with reducing that taste. Other things that we've done is tart foods seem to go over really well. So we had a participant on study once that he was really struggling, and I was helping him brainstorm tart foods, and once he discovered the clementine, it's like they're so easy to peel, and so he'd keep a bag of them with him everywhere. And
it's his go-to snack.
Right, right. Great. And it's not just, you know, to go into all of those would take a lot of time, but we'll be talking about some of the services that are offered here so that people can get lined up with someone that can help them troubleshoot.
But what I do hear you say is we should be tracking and encouraging our patients to track some of these effects. So
absolutely.
Anything that they're experiencing, they just probably need to share that with their dietitian or their provider.
Right. Good communication is so important, and being curious if nutrition could play a role.
You bet. You bet. And so that kind of ties into what most cancer patients have is someone who's sort of their right hand or their caregiver. How do you encourage caregivers to really address or identify some of these issues and be part of that process? Yeah.
So in getting ready for the show and kind of thinking about what messages are important to share, I think, you know, caregiving is exhausting. And so I know you come at this more from a psychology lens, and so I'm actually going to steal from your field and just remind people that they really need to take care of themselves so they can take care of others. And then focusing on the food, again, approaching with curiosity. What are your favorite foods right now? I mentioned Mr. Clementine guy. You know, if somebody could have kept bringing him clementines, he would have loved that. So what are your favorites? What kind of things are you craving right now? I also think that just generally speaking, a lot of times we have these meal trains and things to bring foods.
We call it cards and casseroles.
Yes,
it's
right?
the joke we
and
make,
it's so loving.
It is loving. Yes.
One of the things that I think might help take that to the next level is reminding people to put those foods into individual portions that people can heat up, because the appetite and how people eat is just so sporadic at this time. And so if they're in the freezer and waiting for them, I just think that's so much more helpful.
Yeah, that's a great idea.
Thank you.
Yes.
And then also the caregivers coming to the visits with the nutritionist. If possible, they might hear different things, and then, like we were talking about the tips and tricks for cancer treatments, they could go home and kind of line some of those things up for their loved one.
And so that can be part of their homework, because I think that so many caregivers are trying to figure out, well, what do I do? And they feel somewhat like they need some instruction. So being kind of that teammate and helping to get the nutrition planning going and maybe going to the grocery store would be a good task for a caregiver. Right.
It's a great way to channel that nervous energy.
Yes. All right. Well, if you guys are just joining us, we have Dr. Jill Hamilton-Reeves here talking about cancer treatment and healthy nutrition. We also have Megan Peters, who's manning our questions here in the studio. So if you guys have any questions, please use the link and use the hashtag #BenchToBedside and ask Dr. Hamilton-Reeves any of your questions that you have about dietetics or lifestyle during or post-treatment. She is an expert and lives the lifestyle as well, which is very commendable. So, any questions so far, Megan?
None so far.
All right. Well, I know you guys have them. Dietetics is always a hot topic for our patients and their supporters. So you're also leading a lot of efforts nationally. And one of the things that you're doing is how nutrition influences surgical outcomes. Can you tell us a little bit more about that study?
Yeah. Well, it's an incredible privilege. It's not just me. This is leveraging the NIH and how they fund research, and then the Clinical Trials Network across the United States in order to see this question through and see if we have an answer. Essentially what we're doing is, I had mentioned at the beginning how cancer treatments increase nutritional demand, and different treatments have different specific demands on the body. So surgery itself, we're getting cut open, and the body is going to respond to that, as it should.
Right.
And so we want an immune response, and then the immune response then talks to the body to get inflammation, and then you're supposed to resolve that and heal. One of the things that we have found is with some of the major surgeries, that immune response might be a little overreactive.
Okay.
The inflammation hangs on a little too long, and then that makes patients more susceptible to developing infections and getting complications. The other thing that we see in some major surgeries, bladder cancer surgery is one of them, that's what our project is focused on, is we see that after these major surgeries, people lose a lot of weight without trying. And it's not the good kind of weight. It's the wasting away, losing their muscle and their strength, and it's really hard to watch. And so we did a small pilot study here at KU at the medical center, where we looked at 2 different kinds of drinks to meet the nutritional demand of patients at surgery. One is kind of your basic drink before and after surgery.
Kind of like a protein slash
Yeah, it's protein, calories, some good vitamins and minerals, good stuff. There's nothing bad in it. And then the other drink is essentially that same type of drink, but we've spiked it with some additional nutrients that we think are very specific to the immune system's needs and the resolving the inflammation and preventing the body from eating up its own muscle and fat after the surgery to heal. And when we did the small study, we did find clues along the way that that perhaps we are supporting the immune system better. Inflammation is resolving faster. People kept their muscle on a little bit better. And really the part that got the national attention and some international attention is that we found fewer infections and fewer complications after the surgery. So right now we have this national trial where we're trying to see, what we found here in this small setting. Is this real? Is it worth asking people to get these doctored up drinks that do cost a little bit more in order to have better outcomes from their surgery?
Great, and that's a practical approach to using the body to enhance that immune response. But I think from the patient perspective, shorter times maybe in healing, a nutritional value at the same time, that's a real positive study. So I know you got a lot of patient input on that, and it's at how many sites across the country now do you have this study open?
Yeah, that's a great question. So I think last I looked, we were around 20 or 30 sites.
That's great.
We're still getting things revved up to get sites open. So you and I go to Chicago here in a week or so, and so when you're at meetings, if you can talk it up, I'll be talking it up. But yes, and for listeners, if you know someone that is having a surgery to remove their bladder, have them ask, because this trial should be open to everyone that has access to clinical trials. Right.
And the great part is this is a study that was built here at KU and is now helping patients across the country.
Yeah, so we're a hub for this. Can you believe it? It's so great.
It's fabulous. So I think Megan has a few questions for us. So great.
I have quite a few questions. So the first one is, how do we increase hemoglobin, white cells, and red cells through treatment, through nutrition?
Oh yeah, so that's a great question. I have a feeling that might be related to some of our people that are dealing with recovery from bone marrow transplant or some of the other cancer treatments. So I think working with a dietitian is probably going to be my first go-to, because really understanding what's behind the pathology of that is going to be super, super important. I think 2 of the very general things that I could say, on the line is really thinking about food safety. So making sure that that you're washing your foods and keeping the foods safe if you are in a vulnerable place as far as your immune system goes. And then the other piece, I had mentioned protein. I really think that's going to be an important part of being able to support those red blood cells because of the iron that contains and some of the other minerals. But again, if this is a very specific scenario, which it sounds like maybe they're going somewhere there, reach out and get a clinical dietitian that's credentialed to help.
Great.
Okay. Another question I have, for those who do not have caregiver support and do not feel well enough to prepare meals, what resources are available for patients to receive healthy meals?
Oh, that is a great question.
It is a good question.
Yeah, and maybe you can help with some of these too. So getting a social worker involved is extremely important, especially if the person asking this question might have limited resources as far as funds go. For seniors, there are lots of different meal delivery services. So Meals on Wheels is a popular one, but there's many others that, again, if you're plugged in with a healthcare team and a social worker, they can really help line up those resources in a way that astounds me, and I love social workers. They're just so caring. The other piece is for people that might have a little more means, there are a ton of meal delivery services out there, and without endorsing any one, there are some that are even very specific to the side effects from cancer. So a Google search, reaching out to us maybe offline afterwards, because again, I don't want to sound like I'm endorsing any kinds of companies, but I do want listeners to know that that is an option that's out there. And
there's also a local kind of regional grocery store chain that the dietitians work with our patients, and they also do delivery to the home. I know you have to hit a certain threshold, but that could be another good solution for someone who has limited caregiver support. Yeah.
Great idea.
Good.
Yeah.
Our next question is from Joe, who has prostate cancer, and he would like to know about milk products. He wonders if the hormones could be passed along.
Yeah. Okay. So that's kind of a that's a deeper question.
Yes.
So just to kind of bring the whole audience into some of the controversy with dairy and prostate cancer is that for about a decade or so, there's been an association, as you look at population studies, of increased dairy consumption, increasing the risk of prostate cancer. And so several researchers have spent some time looking at that to look at mechanism of why could that be, essentially it comes down to some people have more of a genotype or a blueprint in their DNA that makes them a little more susceptible to increased risk of prostate cancer with dairy consumption than others. And what that looks like if you don't have your genome, typically people of color have the genotype that increase the risk of dairy and prostate cancer risk. And then you had asked about hormones. So wait, before we go on to hormones, one piece that's really important with dairy is that if men have prostate cancer, they get treatment, the prostate cancer comes back, and they go on to get hormone treatment, one of the side effects from hormone treatment is actually losing bone mass. Right. And so at the expense of scaring people away from dairy, I think really talking with someone about your history individually is very helpful to know if dairy is something you want to continue consuming or not consuming. Many of our patients with prostate cancer do continue consuming dairy, but they do avoid taking high-dose calcium supplementation because over the daily value, which is 2 grams of calcium, really isn't going to be necessary for healthy bones, and could be associated with that signal that we see with increased risk of prostate cancer and dairy is that calcium component. Now going to the hormonal piece, which is a whole nother story. So prostate cancer is often a hormonally dependent type of cancer. As far as the hormones in dairy, there really isn't compelling, strong evidence that that the hormones in milk are going to lead to cancer. That being said, if you are concerned about the byproducts in milk and the farming industry and what you support, going to a milk that might be produced in a farm where they don't use exogenous hormones is something that you can absolutely do, but it's not necessarily something that is evidence-based or part of our advice.
Right.
Was that clear enough, or did I go all over the place?
That's a hard question, though. It's sort of a loaded question.
It had a lot to it.
It did. So what you're talking about, too, is the need for that individual dietetic sort of assessment. And I think that probably is a good segue into some of the resources we have available at the KU Cancer Center. Do you want to talk a little bit about what's available and how folks would potentially access that if they have additional questions?
Yeah, absolutely. So the Cancer Center, KU Cancer Center, is a bigger entity, I think, than many people on the outside may realize. Right. So there are those of us that get the luxury of discovery and having research teams and doing all of those types of things. But then there are those of us that see patients day in and day out. So our team that sees patients day in and day out at the KU Cancer Center, there's 4 dietitians. 3 of them are board certified in oncology nutrition as well, and I'm sure that 4th one will get there someday. She's a newer dietitian. One of those dietitians is actually a person that we co-authed with.
Oh, good.
She was one of my first master students, and you were on that paper and really helped us. So that's very fun that she is really kind of grown. They grow up so fast.
They do grow up so fast. Yeah. We started when we were 12.
Yeah. So Bethany Diggett, and she's definitely getting experience and really kind of leading the way in that team. The dietitians are available to everyone at all of the Cancer Center sites. They see patients that are going through their treatment. They also see survivors, and they even have open times to see people that are at higher risk.
Right.
And so that is an option. Some of the things that they're focused on right now, they've really become a lot more involved in BMT, so bone marrow transplant. They're getting more and more involved in the surgical setting, somewhat because of the conversations we have back and forth from research to clinic, that they are seeing what we're doing on this national study and trying some early adoption of that as well. For dietitians, just to be quite frank, is not enough. So if you don't get in right away, please be patient, keep asking. It's something that our health system probably needs a little more volume about, that this is important in order to sustain our patients.
And I think some of the unique things they've been building is we do have a new women's cancer program.
Yes.
And through that, there's a dietitian on the multidisciplinary team with a medical oncologist, a gynecologic oncologist, a dietitian to talk to high-risk women with genetic mutations. So there's a lot of unique services that are being provided through dietetics. And then, like you said, everyone needs some information. So I know we're working hard to develop some online and digital tools to help our patients as well. So I think that there's more to come, and the first part is assess what is going on, talk to your provider, and get a referral to see the dietitian. Or ask for the referral.
Right, absolutely.
Megan, did you have any other questions for us?
I do have a few more questions. So this is from Tammy, who she says, I am stage 1A hormone positive. I've had a lumpectomy, radiation, and now tamoxifen for 5 years. I heard tamoxifen can make us gain weight. How can I prevent that from happening?
Yeah, so actually this dovetails into some of the work we've done together and that you've led for years. So at the beginning of the show, they saw the video of Brian, right? So Brian was one of our research participants in prostate cancer, where losing weight was actually important for the time that he was at. So we've been talking about building resilience, but that's not a blanket statement. So we wanted to keep muscle on him and keep him strong, but losing some of that excess fat was important for what we were trying to do. Same thing with our breast cancer patients. So after breast cancer treatment, a lot of times women do really struggle with keeping excess weight off. And so we've had several investigators, Dr. Klemp, as well as Dr. Fabian, Dr. Nye, working in a specific program to help women manage their weight in survivorship. And
a portion, about 2/3 of those women were on anti-hormones, like our question asked about tamoxifen. And I think the interesting thing of tamoxifen is, as clinicians and when you kind of anecdotally look at the population, you do see weight gain, but the research says that you don't. But when your patients are gaining weight, when they're uncomfortable, when their body changes, those are things we have to pay attention to. So I think, once again, each person's individual, but all of that slows down the metabolism. So from that specific question about tamoxifen, it's so effective for cancer treatment. We want patients to stay on it, but we want to help them lose weight at the same time. And the research is a little wishy-washy in regards to whether, tamoxifen really is causing that weight gain.
Yeah, and it's part of embracing a new normal too.
Right.
So sometimes I think, particularly women, as far as societal pressure, we focus so much on what the number on the scale might be as far as weight, but there's lots of ways to be healthy, not necessarily what that scale is telling us. So really focusing on the things that you can, so more activity, really thinking about non-starchy vegetables, eating a high-quality diet, and then if you are frustrated, reaching out to someone, because you may think that we're doing everything that we can possibly do, but people outside ourselves can see some of our blind spots and really help us troubleshoot.
Absolutely.
And then credentialed professionals, right, are there to help.
Absolutely.
Right.
Megan, did you have another question?
Yes, I do. This one is from Julia. She says, I had a really toxic reaction to Divo. In addition to losing my hair and extreme fatigue, I lost my appetite. I'm on hydrocortisone, 2 different dosages twice a day now, and although I'm able to eat a little, I don't eat much, and I've lost a lot of weight and muscle mass, and I'm always tired. Any suggestions?
Yeah, it would be really great if you could work with a dietitian. That's the first comment. And I feel for you, I really do. I think, one of the first thing that comes to mind when I think about that storm of just all kinds of things happening and the physiology working against us, one of the underlying issues is this issue of fatigue.
Right.
And I think in zooming way out and helping patients, thinking about movement and movement therapy is a way of getting in touch with the body, listening to the body and what the body needs. Again, I'm not saying do that instead of reaching out to a credentialed professional, but not being afraid to get up and move around. That tends to help reset our appetite. It helps engage some of the muscles so they're more primed to use the nutrients that you're giving the muscle, to store some glucose, to rebuild your muscle and have ample protein stores to do so. So that is a way simplistic answer to something that sounds complicated, but I really do encourage you to reach out to a credentialed professional, and then if there was the first step, I would suggest a first step. So getting some movement.
Get moving. And then I think also making sure that your provider knows that you're experiencing nausea.
So true.
Because there are a lot of new sort of high-powered anti-nausea meds, but those could be used short term, and that could help reset that. And then, like you talked about earlier, sometimes nutritional drinks and supplements are a good gateway, and we encourage that, especially during those times where the appetite is not as strong, but we know we need to get some protein and nourishment in.
Yeah, great ideas.
Actually, building on that comment, the next question was, how do I know what vitamins and supplements I need or that could be helpful during treatment?
Yeah, great question. So
another loaded question.
It is, yeah.
Yes.
So the canned response to such question is that we don't recommend nutritional supplements for cancer prevention or cancer survivorship, as far as just like a blanket statement. Instead, we really think about working with an individual to get them in an optimal range for all of their different nutrients. One of the very tough lessons that nutrition science has learned over the decades is that using individual supplements one at a time or high doses, not only does it not prevent cancer like we thought it might, because we had some mechanisms that we thought we could chase, but actually in some instances we increase the risk of cancer. And so I'm not saying that to scare anyone as far as supplements go, but I'm going to go back to the healthcare provider here and making sure you're very transparent about the supplements you already take, really asking yourself, are you sure? Is this something that I need to take? And then working with someone to really only take the things that are necessary.
Absolutely, and I think so many patients don't think about telling us some of the medications or alternative therapies that they're on, and some of them are actually contraindicated or actually bad or make the chemotherapy or the immunotherapy or whatever treatments we're giving, they don't make them as effective. So we do need to know about that. And as you said, we supplement based on a need that we identify. And I think since I work so much in women's cancers, you know, vitamin D tends to be one of the big questions we get, and that would be informed off of a blood test where we see what the levels are, and we use therapeutic types of regimens. So once again, like building on what you said, this has to be informed by the provider and certain types of blood tests and so forth that we would do.
Right.
Yes.
Great.
Great.
So the last question we have for now, from Ron, just recently diagnosed with CML, taking Gleevec for a month and fighting extreme fatigue combined with leg numbness and weakness. His doctor thinks the meds are killing off bad blood cells faster than he can produce new ones. Is there anything he can do to speed up red blood cell production?
So that's actually very similar to the first question we had. Again, I encourage him to reach out to a professional.
Yep.
Yeah. Do you have anything else?
That would be the best. No, that would be the best.
Okay.
Because he's probably someone that could benefit even from things like chair exercise in addition to some dietary modification. But I think so many people think, well, if I can't get up and do like formal exercise, that's not going to help. But like you highlighted, the movement helps us with the nutrients, and we have a whole series of handouts on chair exercises, so that is something that your providers have access to.
Right. The piece that we're trying to avoid is bed rest, extended bed rest. So anything outside of bed rest is movement that counts, and celebrate that for sure.
Absolutely. And it will get better, and that's the part that if things aren't getting better, we need to know about that as well. So there should be sort of that ebb and flow, and that's part of the cancer journey, but tracking that, being an engaged patient as part of that process, I can't emphasize that enough. It's so important, because without our patients reporting what their symptoms are and how they're ebbing and flowing, we can't help and support them. So our patients have to be their very own advocate, as well as the caregiver.
Yeah.
So as we sort of end today, we've had some great dialogue. We've learned about the amazing research that Dr. Hamilton-Reeves is doing, and she has many other projects going. In the future, what can we look forward to? Things in prostate, like what else do you have going on?
Yeah, so this is where I can monologue for a long time.
Well, we have about a minute for your monologue.
Okay. Well, we featured Brian, so stay posted for the results on that study, because we are really curious. 13 different cancers are associated with obesity. We're really curious if we can develop a regimen that disrupts that link.
Absolutely.
So I wanted to come back to that. We also have a couple of new studies that are really exciting. One of them is going to be opening up in palliative care. We're looking at bitter taste, and it's a sensory study so that we can help people deal with these altered taste changes during therapy by better describing it, and then perhaps using some off-label medications to improve those side effects. We have a study that just got accepted for publication where we looked at a carb-controlled diet in order to prevent bladder cancer from coming back.
Very good.
Dean Maliski, the School of Nursing Dean, she has a study in androgen deprivation therapy that we've already, in prostate cancer. We've already completed enrollment, but we're waiting on the results. I could go on, but I can see from your eyes.
So what you're hearing, what I hope everyone's hearing, is that we have, you just listed off like 6 different research opportunities. So many of our patients, maybe they don't qualify for a treatment trial, but we do have lifestyle trials, trials looking at nutrition, exercise, movement. So those are things that we want our patients to ask about too, because that could be something available to a longer-term survivor as well, or someone like you mentioned in palliative care, patients who have metastatic disease. So we want patients across the continuum to know that we possibly have something. So make sure that you're asking, and we're evaluating you just in case you qualify.
That's a great comment. So if you're asking your care provider if nutrition could help in a curious way, and they say, there's really not much, then ask, well, is there a clinical trial? Because there might be, because if we don't have evidence to have it in clinical care, we might be working on building that evidence.
Exactly, exactly. So to learn more about nutrition and cancer, visit kucancercenter.org/nutrition. And we are so thankful that you came and shared the morning with us. We want everyone out there to join us next week at 10 a.m. for Bench to Bedside, and thank you all for watching.